Yeah. Well, why are we cleaning them?
Because they might have like food in them.
Get all of what?
Debris and bacteria.
Yep, to clean it, to get all of the bacteria and any food that might be in there, because you don't want to close in any kind of bacteria on top of the teeth, because then it can cause a decay underneath the sealant, and lots of failures occur at that time. So once you put it in place, you always want to give it a tug to make sure that it is in there securely, because you don't want it to fall into the patient's mouth. So we're not going to demonstrate the sealant with the rubber dam. Because the patient's not numb, most likely some offices will use a rubber dam whether they're numb or not. You guys can still use the contra angle, I mean not the contra angle, excuse me, the torque converter, just to kind of slow down the rotations per minute. And so we are using some pretend pumice, right? We're doing which tooth number?
Three.
Number 3. So I'm waiting for my assistant to pass me what I might possibly need in order to check number 3. Awesome. So I'll come in here and look. And what else should I do right before I pumice?
Rinse.
Yeah, so I might say, oh, well, I'm going to check this area. So then I'll wait for my next needed item. That's what you're handing me, but is that the way you would hand it to me? Oh, there we go. Thank you. So, I fulcrum. I'll check the surfaces, make sure that there's nothing sticky, make sure that there's no food in there anywhere. The doctor might have me do 2 and 3 at the same time. He'll or she will let me know. And then I'll come back in here and I'll give my assistant my Explorer. I'll hang on to this just because I'm going to polish, right? And I need to take a look and see. Then I will come in here and my assistant might want to grab the suction, because typically there's some pumice on the brush, and if it falls into the patient's mouth, it's pretty gritty and dry. And so we'll turn the bevel of the suction and turn it on. And I'll polish. Good placement. Okay, and now I come out and my assistant will suction. I set up as if I was going to be doing this by myself, so my air water tip is on the doctor's side, but we'll put it over here for my assistant. And how should you hold this? In which hand? There we go.
You got something to spray it?
Yep. And bring the chair in closer in case you need to. I'm going to step back in case she sprays. And sometimes the doctor will even come in and retract a little for her, so, or the hygienist. And we're on number 3. And being careful not to choke your patient in putting it in water.
There's a ton of water back here.
Okay. We'll get it out. Okay, and so then what should she do next?
Air.
And what are we doing before we blow the air on the tip?
Oh, yeah.
Check moisture. Nice. Okay. And sometimes what you want to do is just turn the position of the air water tip so they can get right to the occlusal surfaces a little easier for you. And then some light air. Awesome. So on this next step, what we're going to do is, now that we're retracting, it's a good time, and I really did set up as if I was doing this by myself, to start placing cotton rolls. If it was on assistant's side, she would be starting to hand me these things. Always thinking about the step ahead of what is going to occur. So she's thinking, okay, she's starting to put the cotton rolls in. The next thing she's going to possibly want would be some etch. So again, we'll help her figure that out because I have it all on my side. I'm a greedy doctor. So we bring our little cotton roll in here, and we just tell Toby, okay, you're going to feel a little bit of cotton next to the cheek here. It's okay. We're just using that to kind of pull your cheek out of the way. We're going to get ready now to prepare to use a little bit of etchant material on top of the tooth to help dry it out so that your sealant is able to stick to it. Please raise your hand over there to the left if you need a little bit of suction. Please don't close down. Nicole will get the moisture out of there for you the best possible way. Okay, we're going to go ahead and have you tip your face over to the left and look at that pretty assistant you have over there. And then we'll get going. Okay, so that's all my great spew. And why are we turning our patient over to the left?
So you can access the tooth easier.
And so that any saliva will flow away from the tooth, right? So we just have them turn over that way just a little bit, okay? And I can still see my tooth very well. You know, he is not very saliva producing, so he's not gonna get us in too much trouble. So I'll kind of put this back over here and help Nicole help me. Stop trying to be so greedy. So again, this tip would be for which material? The etchant material. Yep. And then this one is for the, and why would you know that this is for the sealant? It's black. And why is it black? Light sensitivity. Awesome. You guys rock. So I'm going to give this over here to Nicole as well. And I have some 2x2s also. Some offices and some doctors will use dry angles. They look kind of like triangles that you can tuck inside of the cheek area. It'll help to cover a duct on the side of the mouth as well. Some offices use 2x2s. I'm a little bit from the 90s. We use a lot of 2x2s to keep things dry so bad habits don't go away easy. So with that being said, we're going to have Nicole put the tip on for my etchant. That is the only one that we will keep the tip on, okay? And she'll put that on there for me. And how long are we going to leave our etchant on for? 30 seconds. Yeah, 30 seconds. Now, it might be different in other offices because you need to check the manufacturer's label and suggested time depending on what kind of etchant you're using, okay? And so, Nicole will pass. Great, pass. And here we go. So I'm going to just go ahead and retract. And you want to be really careful when pushing. And the reason why we don't leave it in the tips is because sometimes if the tips aren't screwed on very well and it it gets hard. Well, it is kind of like an oxidation thing. It gets hard because the air has gotten to it and has caused it to solidify a little bit more at that tip. When you push, that tip will go pew, and everything shoots out. And remember, this is a type of acid, so it could irritate the skin. So you always want to make sure it's on nice and tight. You have a fresh tip, take it off, put the cap back on to kind of keep it preserved. So we're on to number 3, and we're only just doing some occlusal surfaces. If we were doing any buccal pits, you would just bring it here. If we were doing, and then since I don't want my patient's cheek to touch that etchant, I will just retract it with my finger. And then I can just put some on this lingual pit here. And there's a little groove. You guys will learn some more about anatomy on the first molar a little later. But sometimes it's called the cusp of Carabelli. Sometimes if the development of the tooth is really profound, you might need to put some etchant material in that groove as well. So we'll wait for our 30 seconds. I'll give this to my assistant. She'll take it off from me. Thank you. And then while I'm retracting, she will now, you go ahead and put everything down. And then you're going to get ready to suction in a minute. Always air, water, suction go together. Usually they're always in like the moment. Sometimes you have them both in one hand and you're grabbing things with the other hand, but those two love each other, just like the explorer and the mouth mirror. They are in love, so they pretty much go together all the time. All right, and there goes our suction. Now, always hold palm right. There we go. And then go ahead and lean towards Nicole and pretend that they did that. And you want to, and when you suction it, you want to kind of gather the etchant a little bit first, so that way it doesn't get all over the mouth. And now you want to bring your air and lightly add some air, water to it only. There you go. So keep going. And remember, it's a constant flow of water. For how long? Okay, so we'll pretend that was a good 60. And now air only.
So you don't have to put it out?
Nope. Keep the suction there. Remember, we always want to get all that moisture out. Remember, because you can't get your sealant on if the tooth is wet. So just air. All right, good job. And now she would come out on this moment and she would grab her saliva ejector. And now the saliva ejector is going to go into the corner of the mouth to help the patient with staying dry. Because now that the patient has moved to this part of the sealant procedure, they need to not close at all, right? And so, I will take my mouth mirror and I will check and see how it's looking. It's not going to be really frosty looking for us because it's a plastic tooth, but typically if it was a natural tooth with enamel, it would be pretty frosty looking, and so it looks really, really dry. That would be when you know that it is time to start beginning to seal the tooth. Okay? I always want to keep everything from. So now, Nicole will add a drop, a really small drop. Oh, we'll just hang on.
Hold that.
I think we have something over there. Oh, there it goes. I'll hang on to it. We'll put that there. So just a small drop of the bonding agent is what we're going to use first to put on there.
No matter which thing it's in?
Nope, you will just tell me where you put it. Wherever she puts it, she'll just remind me. So in this procedure, she'll probably have the bonding agent in one and then start to put the sealant in the next one because we're going to begin to start moving along with the procedure.
Just one drop?
Yes, please. Yep. And then you want to close it immediately because, again, that's light sensitive and you don't want it to spill. It's pretty costly. All right, and she'll hang on to that, and you can go ahead and add a little bit of your sealant into the next one, so then that will be the next step that we will do. And we're going to use a little bit of six-handed dentistry. Can you grab me another bender brush over there, please?
Do I need a tip for this?
Nope, remember we're just going to drip it across. Don't put it in the same one as the bond.
No,
No.
the bond in that one.
Okay, yeah. It can be, yes. I just to make sure it wasn't mixed with the bonding agent. Yeah, way too much. That's okay.
It came out really fast.
Yeah, but they put your top on there pretty quick. And probably wipe it off so it'll seal. It'll set. We'll pretend she had on gloves. Okay. So now Nicole is going to come with to me. She's going to hand me the bender brush. She's going to hand it to me in my right hand, so it should be in her left hand. And the way that she handed it to me was perfect because I'm working on an upper tooth. So the fact that she gave it to me with it pointed up is awesome. So then I will come here. We'll probably flip our light to dim it some. And I will want to cover your sealant because I'm not going to use that one quite yet. And then I will come in here and I will paint the occlusal surfaces of the tooth that I am sealing with the bonding material. I'll give this to her. You're always ready to take, and I'll need some air. So I'm checking to make sure my air is not getting any moisture. And I'm going to just kind of spread it around. I'm handing this back to my assistant. I come in here with my light cure. And then I want to kind of block it from staring directly at it. And we'll get one bead. And then we'll go another time so we can get 4 beads. That'll be 3. And the last one it'll shut off with. It's good. Okay, and then next we'll get another bender brush and we'll start to apply the sealant. And I kind of move my light down even more because the sealant is, again, light sensitive. And so I will apply it on the occlusal surfaces, right in the grooves. And I'm going to show you the trick that I use to avoid having to do a lot of adjustment. And I'll need a mirror, please. Remember, mirror gets always to that left hand there. And you do this because you remember I put etchant on those grooves on the lingual surface. Then I'll need a cotton applicator, please. Okay. And then this is what I usually do to help me with any excess that would be on the tooth. I just take it and swipe it off, and then I'll come back in here with my curing light. And in this moment, Nicole is going to get ready to give my patient a suction and rinse because they've been open for so long, and they will want that. And we're going to do it another time because these are on 10 seconds, so we need to give it a minute, remember. Awesome. So, all right, Nicole's going to give you a little bit of a rinse. And then while she's doing that, I'm going to get my Explorer and my mouth mirror. And I'm going to check the occlusal surface to see if it lifts or pops off, or if there's any voids in it that I need to add anywhere, if I missed a spot, and just to make sure that the sealant was properly applied. Again, this might just pop right off because it's a plastic tooth, so I don't expect it to stay on very well. Beyonce says no cameras.
Is this rinse not dry?
Rinse and dry. Nice. Okay. All right. So then I'll come in here, just retracting, and I'll check to see if my sealant is in place. And it's there a little bit, as best as it will be for a plastic tooth. And so now I will give this back to my assistant, and now we're going to check the bite of the patient. Okay, so with that, we're using, what is this called?
Articulating forceps.
Yep, and the paper. And it doesn't matter if you're going the red side, blue side, but you know, we're from Seattle, we like Seahawks, so we're going to have a bite on the blue side. So we'll take this out to help them. And so you want to always retract again, and then you just give them the instructions. Okay, I just want you to bite up and down, just tap your teeth like normal. Oh, pretend they're tapping their teeth. Oh, that's pretty good, huh? And then come out here, we'll get our mirror again. And that looks pretty good to me. It's every mark that it's marking evenly on the teeth in front and on the teeth behind, and it's only hitting the cusp and not the grooves. So then that means you won't need the high speed with what kind of stone? A white, starts with the F. Friction grip, white friction grip stone. Okay, and then you would begin to start and do the rest for the lower. Only thing I want to show you now is that if we were working on the lower, when placing your cotton rolls, we're going to have to grab an extra cotton roll. So I usually put 2 in there. I don't have an extra one just to be on the safe side. So if you were doing, let's say number 30, 31, 32, then when you're applying your cotton rolls, you're going to, I'll have my patient look at me for this just to make sure that I'm not pinching them anywhere. You want to have them open wide as they're able to. And then you're going to retract the tongue. And then I will take a cotton plier, please. Awesome. And then using the cotton plier, you would just come inside here. Oh, yeah, his tongue will come off. and then you just place it in like such. Sometimes one cotton roll is enough. Sometimes you might need to have two. So I always set up for 3 just to be on the safe side. And then you would just place it right on top of each other. And then I would come over here, and then I would place this one on the buckle side. And then that kind of keeps it nice and dry as well. And it kind of helps to retract the tongue, to keep the tongue out of the way. But the thing about it is, since it's on the lower, there's a lot more saliva ducts and glands down there, so a lot more moisture occurs. So you're going to probably need to have at least 8 cotton rolls set up to help, because as soon as you etch it and you dry it and you rinse it, you need to take those out because they're nice and wet. And now you need to put new dry ones in as you're starting to do the rest of the procedure. So maybe we'll spend some time looking at that sometime next week, and then I'll show you how to do it when you're just doing it by yourself as well. But hopefully that is good, and I just can't believe you guys post this online.
Shit, you got 250.
Oh, that sucks though. I mean, oh, it's so nerve-wracking. I was like, oh,
She got
scared.
250 views.
That's scary.
Wait, on where?
On YouTube.
What? I want to grow up.
Is this on YouTube too?
Huh? Oh, this is okay, go Seahawks. All right. This sucks. That's scary.